Hi, I'm Dr. Noah Kaufman, a 20-year-plus board-certified ER doc and founder of KaufCare, Advanced Urgent Care. For 20 years, I worked as an emergency room physician. And during that time, I saw the best and worst of American healthcare. I saw incredible nurses, doctors, techs, and specialists doing heroic work every day. I saw lives saved. I saw families comforted. I saw people get a second chance. But I also saw something else. I saw patients leave the hospital alive, but financially devastated. I saw people avoid care because they were terrified of the bill. I saw patients with insurance get charged thousands of dollars before they ever met their deductible. I saw self-pay patients get punished the most, often charged multiples of what insurance companies actually pay. And I saw the same pattern over and over again. Nobody knew the price. Not the patient, not the family, not even the doctor. That's one of the hardest truths for me to say out loud. Physicians go into medicine to help people. We take an oath to first do no harm. But in this system, many of us have become witting or unwitting accomplices in a machine that can cause real financial harm to the very people we are trying to help. Most doctors are not bad actors. Most of us are doing our best inside a system we didn't build. But the system is broken. It's opaque. It's bloated. It's confusing by design, and it has turned ordinary medical care into one of the most financially frightening experiences in American life. For years, I saw this from the physician side. Then I became the patient. I developed a serious back problem and found myself needing surgery. Suddenly, I was the one getting multiple opinions. I was the one trying to understand what something would cost. I was the one comparing insurance-based pricing, cash pricing, deductibles, facility fees, surgeon fees, imaging costs, anesthesia costs, and all the invisible charges that show up later. And honestly, it was infuriating. Even as someone who understands the system better than most people, it was still hard to get straight answers. That experience changed something in me. Because if I, as an emergency room doctor, had trouble figuring it out, what chance does the average patient have? I realized I didn't want to just complain about the system anymore. I wanted to build something different. That's why I created KaufCare. KaufCare is built around a simple idea. Patients deserve excellent medical care, transparent pricing, and a doctor who is actually on their side. We are not a hospital. We are not trying to replace the ER for true emergencies like heart attacks, strokes, major trauma, or life-threatening illness. But the truth is, a huge percentage of what shows up in the emergency department, it's not life-threatening. Lacerations, abscesses, sprains, fractures, dehydration, migraines, infections, eye problems, foreign bodies, ingrown toenails, shoulder injuries, procedures that can often be handled safely, quickly, and dramatically less expensively outside the hospital. We are building a new category of care. An advanced urgent care. Physician-directed, transparent cash pricing, no surprise bills ever. No months of confusing statements, no collections, no pretending that healthcare prices have to be a mystery. Our prices are posted publicly on our website. You know what things cost before we do them. And because I spent 2 decades in emergency medicine, I know what belongs in our clinic and what belongs in the ER. And that matters because good medicine is not just about what you can treat. It's about knowing what not to treat. It's about judgment. It's about honesty. It's about doing the right thing for the patient. I built KaufCare because I believe patients deserve better than the current system. I built it because people should not have to choose between getting care and protecting their family financially. I built it because doctors need a way to practice medicine that is more aligned with our oath, our conscience, and our patients. And I built it because I still believe medicine can be personal, human, transparent, and good. And that's the origin of KaufCare. We're here to give people a better option, better care, clear prices, a doctor-led clinic, and a team that treats you like a person, not a billing event.